So we believe that periodontal diseases, and of course it's several diseases, affects athletes in different ways. First of all, the inflammatory route. So what we have found, particularly in our recent study, is these athletes have a lot of periodontal diseases. So they have gingivitis in more than half of their mouth, and 20% of them have periodontitis. And that clearly, from what we know from the general literature, increases the systemic inflammatory burden on the athletes. And there is clear links between the inflammatory burden and athletes' repair of muscles and responsiveness to training. In addition to that, periodontal diseases affects people's confidence. So we have very clear evidence from our studies that a large proportion of the athletes report bleeding from their gums when they clean, and that also has an impact on their confidence and their confidence when they're training. So it also has impacts on their relaxation, so some of the other psychosocial impacts like relaxation and sleeping and ability to eat. So you have these effects on eating and sleeping, you have these effects on relaxation and confidence, and you also have these direct inflammatory effects on the athletes. So in terms of improving the general population's awareness, in fact I'm part of the British Society of Periodontology, and we're working in bringing patients to help answer this question. So we've got a meeting coming up next month, and we're bringing patients together to explore how do you raise public awareness. I've been involved, I was president of the National Society, the British Society of Periodontology last year, and over the last 2 or 3 years we have run public awareness campaigns. We have worked together with advertising agencies who are experts in creative messages and embedding that within social media. And we've had really some big success in raising awareness. But I think an absolutely key development is what I've just been talking about, which is the patient forum. So patients have some really great ideas about how we can get the messages across, and very much how do we reach groups of people that at the moment we may struggle to do. Because periodontal disease, or periodontal diseases, affects some sections of the population much more severely than others, the most disadvantaged particularly, and sometimes getting messages across to those groups can be challenging. So we're looking forward to developing new initiatives with the involvement of patients on how we can do that. If we're thinking about athletes, I think one of the things that we've learned over the last few years in working with athletes is this, that for athletes it's really important to focus on what the motivation would be to make a change. I think there's less interest in understanding that an individual athlete might have gingivitis and periodontitis, but I think there's a lot more interest in understanding that those conditions, as well as the other health conditions that we find, such as caries and erosive tooth wear, can have an impact on their performance. So we're making a very clear intervention for the athletes and for the team around them. So it's very important not just to think about the athlete, but the team around them, the nutritionist, the physiotherapist, the coach, the sports director, to help everybody get motivated to recognize that the oral health may impact performance. And that's, I think, a very strong message which might help drive this change.